All right, I'm very excited. As I mentioned early on this morning, we have an absolute legend sitting beside me in the Toronto radio industry. Todd Shapiro is in the building this morning, CEO and director of Red Light Holland. It's great to have you, and welcome, first of all.
Yeah, thank you so much for having me. This is like an incredible setup. Like, great job, guys.
It's really yeah, it's a lot of fun. We get to talk about the market, hang out every day, talk stocks, and talk about an industry in the psychedelic side of things that I find personally fascinating. And I was mentioning to you here just before we came on that it feels a lot like the early days of the cannabis industry right now. You're starting to see the retail pop up. You're starting to hear about it a little bit more. Obviously, there's a lot of things that have to happen to get it to that point. But give us, from a higher view here, where are you at as far as this industry is concerned?
Yeah, so Red Light Holland has a very interesting model within psychedelics, and specifically focused, we're on psilocybin.
Right.
Magic mushrooms.
Right.
The stuff you've probably tried. I don't know if you're allowed saying that. The stuff I imagine your whole room has probably tried. Who's tried some mushrooms? Who's tried some mushrooms, boys? Ladies? Anyway, but we're trying to really, truly doing it responsibly. But we're a company that speaks for the people. And why do I say that? Because there should be a right to try. You should be able to do it responsibly with education and information.
Yep.
And most importantly, we believe, and studies are really showing this, that it should be able to help people going through trauma, our veterans going through post-traumatic stress disorder. So we are always about the naturally occurring product. And you mentioned the industry as a whole. There are some that are biotech companies. They're going like to tweak a molecule, patent it, become the next big pharma, which, by the way, and I say this all the time, that's okay, because ultimately if that leads to a pill that's standardized that maybe your mom or my dad might prefer over a naturally occurring thing where they're nervous about the contents inside of it, that's good if it helps people too. But at the end of the day, we're seeing a big sort of, I don't want to say protest against big pharma, but we're seeing like some hesitancy.
A little pushback.
Yeah, we're seeing a little, nervousness. Like, what are we putting in our bodies? Why are we doing this? Stuff from the ground. Tens of thousands of years that this has been going on for indigenous roots and everything. So why not have naturally occurring products done responsibly well? So, sorry, I'll talk forever. Back to the shops you mentioned, what's going on, like cannabis, is cannabis came in, and especially here in Canada, originally it actually was passed for helping with patients with AIDS to deal with their trauma that they were going through. And then slowly over like about 18, 20 years, it eventually became, as we know, legal in this country. And we saw illegal shops popping up, and then they'd put big blocks in front of them, and they'd get rid of them, and they were forced to doing regulations. So yes, we're seeing shroomies pop up all over Canada. We're seeing like Six Toronto here in Toronto, fun guys, very clever names. And for us, it's like, yes, this is good because they're outliers. We have to respect what they're doing, but they're doing it illegally. So will that force a charter challenge to allow companies like ours, who pay a shit ton of money in audits, legal opinions, publicly traded stuff that is the very expensive corporate cost of being public, Red Light Holland, TRIP on the CSE if anyone's interested, or TRUF on the OTC. But do your due diligence. I'm always told to say that. But long story short, we're doing it very carefully, and we believe that there is a future.
So let's dig into that a little bit. Where is the next step is obviously going to be on the regulation side. It's going to be on the legal side of things. What needs to happen? We can speak on the Canadian side of things when it comes to regulatory steps that are needed, or the US, up to you. I'll leave that in your hands. But what needs to happen here to get to that next step?
Yeah, one, we need advocates. Advocates are people, the right to try. So that's an important thing. Secondly, governments are being progressive, similar to cannabis. Oregon, one of the first states in cannabis that pushed through legal cannabis, is now doing the same with Measure 109 in psychedelics. They're allowing a therapeutic use of it right now. Colorado has been making some big strides too. SB 109, I believe, is in Colorado. Washington State, California now is starting to open up. They have their bill as well. So a lot of senators and spokespeople for small towns in these different states are talking about decrim, which is good and bad, because decrim doesn't necessarily lead to a regulated process on how to use it. And the others are talking about this therapeutic use, which we think is really important too, where, and we focus on microdosing, but the therapeutic use right now deals with sort of like this heavy hero dose, they call it, where you take a lot and you're guided through a facilitator and a therapist to deal with things that might be going on. And luckily and hopefully we're seeing good results in that model. But that model's expensive. that model is a little bit, in my opinion, elitist, because who can afford that kind of way to go and get therapy? Think about the United States alone. They're already having so many issues with their medical systems. Why not have a microdosing approach? And we think microdosing can really help, not only like on the day-to-day, but it can also help with the affordability, the access, and perhaps not just dishing it out like you would see at a cannabis dispensary, but perhaps get it like a cup of coffee. You go get your cup of coffee, a facilitator's there, they mark off what you do, and then in about 20 minutes, they see there's no contraindications, off you go to hopefully enjoy your day in a more peaceful manner.
Where is the opportunity going to come from here? And when I say that, I mean, what part of the actual business? A lot of people watching have probably seen the headlines on the medical side, seen the research-related medical headlines, but in your opinion, where's the opportunity in this industry going to come from?
Yeah, I mean, there's huge opportunity. We are a company that deals anecdotally looking at studies every day. And if you put those together, that would be like your biggest phase 1 study ever, meaning go and look at the numbers. Tens of thousands of people, if you hashtag microdose, you can read up on what they're doing and how it's working for them. So that opportunity to me is helping veterans, helping our first emergency responders. Let's start with that. That's the most important thing we can be doing. But helping with trauma, like for all of us. I mean, the world right now is in a very difficult place. Wars all over the place, divides in politics, divides in religions, divides in people. Think about what our children are seeing online as they're scrolling through, seeing dead bodies, seeing, you know, bombs blowing up. Like, there is so much going on right now. So the opportunity to me, and maybe it sounds like a bit of a blanket statement and a generalization, but it's to fix this world. Like, that's the opportunity. If everyone woke up, and I can't make medical claims, but I truly believe this, if everybody woke up every day and took a microdose in their drink, I bet you we'd all be getting along a lot better. So that to me is the opportunity.
Tell us about Red Light Holland. What do we need to know here from a viewer standpoint, someone who, you know, maybe is new to the industry, might be hearing about this for the first time. What do we need to know about the company?
Sure, great question. Do we have an hour? There is so much going on.
It's YouTube.
Let's have fun. I mean, I love this stuff, by the way. Thank you again. Red Light Holland started off working within a legal framework in the Netherlands. Magic truffles are legal. You can get them next to like a Baskin Robbins or a Nike store. Like they're just out in the open, except for the fact that they're done in kind of like seedy head shops. Like, you know, they're called smart shops. And it's great, but have people thought through how people can buy magic truffles? So when I took the company public about 3.5 years ago, we wanted to bring education into it, meaning we created telecounseling support when you buy our truffles. We created an app that is a privacy-first app, but if you want to share with us your data, then we can get analytics on this and share it, which we have done, by the way, with Oregon Senate when they helped write Measure 109. We were showing what consumers wanted, what dosage was working, and what was being effective for different body weights, but different ethnicities. You know, people would put in that data, and then we could learn on how it might be able to help. And that was very effective. So at the end of the day, that's how we started. Then we realized, quite candidly, we raised a bunch of money. We got caught up in that big hype of the psychedelics. And, you know, as the CEO, who is the largest shareholder in the company, that was like an amazing time for me, but a very stressful time for me.
Of course.
And the reason being is it was skyrocketing, but we didn't have much. So you get a 270 million market cap, and you're like, oh my goodness, like, you know, where's it going to go from here? And obviously, everybody wants the unicorn. I still want the unicorn, but at the end of the day, you know, I was worried about where we may be. So we raised, at least on the back of it, with less dilution. I think last at about 43.5 cents. So, you know, we raised overall over $20 million. So we're still sitting, last reported, with 17.5 million. That is 17.5 million. Not a lot of microcap companies can say that. And, you know, getting back to it, we then pivoted, though. What was important for us was revenues now, and there weren't many catalysts coming. So ultimately what we did is we said, hey, maybe we get into mushroom farming, because growing a magic truffle, growing a magic mushroom is farming at the end of the day. And to be honest, we made some really good moves. We partnered with some of Canada's biggest mushroom farmers. One of them is Mike Medeiros from Carlton Mushroom Farms. I mean, this guy is a private company, but I'm sure he's doing like, you know, tens and tens of millions of dollars in mushroom sales. We partner with guys named Nick Furlano and Stephen Rody. They're in the exotic mushrooms, which are lion's mane, shiitake, and oyster. So these are all edible mushrooms that are getting you into the sort of this mushroom coalition to learn about, maybe one's good for gut health. Maybe one's good for cognitive. Maybe one is immune boosting. And the magic stuff, it just happens to be good, and we're learning this through science for the mind. So we're a mushroom company. We have home grow kits on Amazon right now. If you go and look up Happy Caps or Mr. Caps, which is a great partnership with Wiz Khalifa that we have going right now. Yes, Wiz Khalifa. And this is learning about edible functional mushrooms that you grow at home, cook with. And so we're a mushroom company. It's pretty cool.
It's exciting, and it's early days, obviously, for not only the business but the industry itself. If people want more information on the product, on the industry itself, where would you send them?
Yeah, I encourage you to go to the Netherlands. Let's start with that. If you're over 19, walk into. We own a smart shop there called Smart Trek Utrecht. Actually, it's just called now it's called Mushroom and More. We switched the names. Geez, we got so much going on to end the stigma around that seediness. We wanted to make it more of a health and wellness store, and then we distribute our product in the Netherlands to over 200 different smart shops, and use it responsibly. We have a therapist there named Jeff Hamburg. If you're interested in some therapy and you feel like you need it now, as opposed to waiting for maybe these future regulations to come, and we're everywhere. Our Happy Caps and Mr. Caps are on Amazon and the websites. There's so much going on with the company. We even created this cool mushroom lamp. If you want to buy it, it's at wisdomtruffle.com. If anyone wants a tour of the farm one day, hit me up personally. We'll do that too. It's pretty impressive.
Red Light Holland, guys. TRIP on the CSE. Truff, you mentioned down on the OTC in the US as well. Todd Shapiro, the CEO and director of the company.
Who likes mushrooms, guy? Who likes mushrooms in here? From round of applause. Oh, uh-oh. Okay.
Good stuff.
Cheers.